Welcome back, everyone, to our BR Proud Back to School virtual town hall. We are joined now by Dr. Rani Whitfield. Thank you so much for joining us.
Thanks, Carly. How are you?
I'm doing well. Kids are getting ready to head back to school, and I know parents have a lot of concerns, especially with going back to school during this pandemic. Do you have any words of advice if parents are uneasy about sending their kids back?
Well, this is not a cookie cutter situation. Every school's a little different when you look at the sizes of the classrooms, the number of students that may be at the school. And so I understand the anxiety and concerns. I have a child that will be going hopefully to school. We're not sure what their school or her school is going to do at this particular point. But evidence so far suggests that children and adolescents are less likely to have symptoms of severe disease from infection, but that's the current evidence that we have now. And so there's still some concern that a child could pick up the virus and spread that to either his colleagues at school, and they could go home and take it to their family and loved ones who may be older patients or older people or people that have underlying chronic health conditions, which it seems that this virus has targeted. But we have seen syndromes in children as well. So that's where the concern is. So I guess my words for them is we don't need to be fearful. We need to educate ourselves as much as possible. And so that's why I'm glad you guys are allowing us to have this discussion today.
And speaking of that, with kids getting the virus, I know in the beginning we were told they might not have as bad of complications if they were to get it, but it's those parents and those caregivers that they could spread it to. So if you're a guardian of a child or maybe a grandparent is the caretaker, should they choose an online option for their child? Are they at higher risk of getting the virus from their child from school?
I definitely think it's worth considering. Hypertension, chronic kidney disease, diabetes, which is rampant in the community in the state of Louisiana, is very common. I see it every day in my practice. And so I've also seen some individuals who've been infected with the virus have poor outcomes because they have those chronic underlying conditions. There is a group of people in the community, and some of them are healthcare providers that don't believe that it's that serious. But I will be honest with you, is that we truly don't know very much about the disease. We thought it would behave like the influenza and probably be dying down by now. But you see, they're continuing to have new cases that are popping up. Our state is averaging over 1,000, if not maybe close to 2,000 cases a day in the last couple of weeks. And so we have to move cautiously with this thing, but we're not insensitive to the loss of jobs, the loss of money and income. And we know that some parents are compromised because they don't have any way to take care of their kids and work one or two jobs. So some of my patients, the person themselves, will have two jobs, so their kids are in school at a time when they're working. So these are issues that we all have to take into consideration.
And of course, this is something that we all need to take very seriously. And as you mentioned, we're kind of navigating through it together. But there are things that you can do to protect yourself. So as a parent, how can you prepare your child to wash their hands and to wear masks? A lot of children are going to be expected to wear that all day while at school. So what can they do now to prepare their children for what's to come?
Carly, COVID-19 has changed the world, and some of the stuff that probably we should have been doing regularly on a daily basis. I guess we take it for granted. So putting emphasis on hand washing, teaching your children how to wear a mask. Before I send my daughter to school, and she's going to have several masks. Masks are like underwear. You change them every day if you're wearing them for one or two events. But if you're going to school, you may need to change them frequently throughout the day. Again, frequent hand washing. If it's allowed at the school, hand sanitizers kept tucked away. As far as the schools go, they're going to be probably cohorts of classes, and the children won't be moving from classroom to classroom. They'll be eating in the class, or maybe at least having the teachers rotate through a class. So you'll be around the same folks. But the same mitigation things that we talked about initially, hand washing, social distancing, if you can use outdoor facilities to either have classes or definitely recess, but making sure that the spacing is there and available. Those are the things that we need to be repeatedly talking to our children about. And the parents have to be very aggressive and do their due diligence and talk to the schools and see what types of things that they're going to be doing with the students so they can know what to expect.
It's definitely going to be a very interesting semester for all of us. I know we're very thankful for our healthcare professionals like yourself for informing us and keeping us all safe. We're going to have to all work together to get through this upcoming school year. But thank you so much for your time, and thank you for joining us.
Definitely. Thank you, Carl. You guys be safe. Wash your hands and mask up.
All right. Thank you so much. We're going to take a quick break. We'll have more coming up.